Hi, my name is Dr. Blair, and I'm Associate Clinical Professor at the University of California, San Diego. My special interest is in cancer surgery, and I primarily work at the UCSD Cancer Center. Today I'm going to be talking about what to expect before a major operation. We're not going to focus on outpatient surgeries, but we're going to discuss what to expect before a major operation on your chest or your abdominal cavity that will keep you in the hospital for several days. So, before your operation, you will see your surgeon, and they will give you the risks and benefits of the operation, but they often leave out some details which can be challenging for patients that we assume everyone knows, but they don't necessarily know. So, for example, if you have an abdominal operation, you may have to change your diet before the operation. You may have to take only liquids for 2 days before, and also drink a bottle of liquid that's used to clean out the stool out of your intestine. Sometimes it's a small bottle, and sometimes it's up to a gallon. And the purpose of this is to release all the stool from your colon, and so you have to plan to be home for that entire time, because you don't want to be out when you're going to have to go to the bathroom fairly quickly. And your stools will come out, they will turn to looser and more towards diarrhea, then they will get more yellow and then clear, and then you know that you're getting close to being done with the prep. You may also have to take some antibiotics by mouth at home, which can be a challenge because they can make you nauseated. So that's not unusual for the antibiotics to make you nauseated. But do your best. The surgeons want you to at least try to get it down, because it decreases the amount of bacteria in your bowel and in your abdomen before the operation, which is helpful for you to decrease the risk of infection. But many people don't get through the entire thing, so just do the best that you can. You will see, besides seeing the surgeon before your operation, at UCSD we also send patients to see the anesthesiologist. And that's so they can be familiar with what's going to happen that day, and also to go over all the medications that you take. And it's important to also let us know over-the-counter medications that you take, allergy pills, herbal medications, vitamins, because they can affect the operation and the anesthesia. For example, vitamin E can make you form more blood clots, so that can be dangerous if we don't know about it. And even herbs that you get at a health food store can affect the anesthetic, so it's important to let us know. You may want to discuss with the anesthesiologist that you're going to have some special challenges because with difficulties communicating, and you may want to set up some hand signals that may help you once your interpreter leaves and you have to communicate with the anesthesiologist on their own. You're going to have to do certain maneuvers to help us get you situated in the right position on the table, and you may want to discuss that with the anesthesiologist. When you see the anesthesiologist, they will also get some blood tests, some x-rays, and a cardiogram to check your heart to make sure that you're fit for the operation. Sometimes after these tests we may lead to more tests. For example, if there are some changes on your cardiogram, you may need to see a cardiologist, and you may need to get more tests on your heart to make sure that your heart can withstand an anesthetic. And that's not unusual. Or if there's something on your x-ray, you may need to get further x-rays to figure out what it is. once you do all that and you're cleared for the operation, then the night before your operation, you don't want to take any solid food after midnight. At UCSD, our anesthesiologists allow you to have clear liquids 2 hours before for pills. And clear liquids are anything you can see through. It does not include orange juice or coffee with milk or anything thick like a shake or anything like that. The problem with these thick liquids or food is they take a long time to drain from your stomach. When they put you to sleep for your operation, they will put a breathing tube in through your mouth that goes into your lungs. If you have a lot of food in your stomach, then when they try to put the breathing tube in, the food may come out of your stomach back up into your mouth, and then that can go into your lungs, which that can be very dangerous and cause pneumonia, which can be life-threatening. So if you do take coffee with milk in the morning, they may cancel your operation and do it another day. And after you've done 2 days of a bowel prep, that's certainly no fun, because that means you'll have to do it again. So it's really important not to take any solid foods, and just pills with water or clear juice, like apple juice or cranberry juice. The other important thing is no aspirin for 10 days before your operation. Aspirin can change the way your platelets work, and it takes at least 7 days to make new platelets. So you need, to be safe, we say 10 days of no aspirin. Also, there's a lot of medications that contain aspirin or aspirin-like substances, like anything with ibuprofen, Motrin, Advil, Aleve, Alka-Seltzer, a lot of the over-the-counter cold medications, allergy medications. So just look at the box and make sure there's nothing with aspirin or ibuprofen. If you are a smoker, if you can stop smoking, that is the best situation. But the more you cut back before the operation, the better you will do for your breathing. If you could stop for 2 weeks before your operation, that is optimal. However, we know it's a stressful time. So the important thing is to smoke the least amount you can, and no smoking 24 hours before. If you smoke heavily before